at St. Peter's, Zambia Primary School, and we are immunizing or vaccinating teachers and the support staff. It's been a wonderful day because there's a very good turn up for teachers and the support staff, including cooks, askaris, and the rest of the people. Today we've come to talk about the COVID-19 vaccine. That the new one is called Sinovac. It's not the AstraZeneca that we know. It is the new Sinovac vaccine. So first of all, this is a good vaccine for us people, for our children that are going back to school, and for the whole community as a whole. So briefly, the vaccine was given to us by the Germany that is cooperating together with the Chinese to manufacture it and give it to the Ugandan population. I want to encourage everyone to come for immunization, for vaccination. It is very important for you all. I want to really remove the conspiracies, the propaganda out of social media that is everywhere talking how bad this vaccine is, and it is not true. Let me tell you one thing, no one wants a teacher to die. Let me tell you one thing, no one wants a doctor to die. And let me tell you another thing, no one wants an army man to die. So at the end of the day, do it for yourself and for our children that come to school, to the teachers outside there. Please, we beg you, come. So first of all, about this Sinovac vaccine, number one, we don't have to intermix it with AstraZeneca. If you're there and you got your first dose of AstraZeneca, leave the Sinovac alone. It is for the new entrants, people that have not got any jab. Another thing to note about this vaccine is it is safe for many groups of people. Number one, if you're above 18 years, you're kindly allowed to come for this vaccine. People that are living with HIV/AIDS and people that have comorbidities, other diseases, I mean hypertension, I mean diabetes, you're welcome to receive this vaccine. It is safe for you. Let me tell you another thing is these vaccines have gone through a test, a trial, and they are proven effective for a human being. And another thing is we need to really be conscious about what people say about this vaccine. Come to us, talk to us, ask us questions, and we shall answer you. So lastly, when you're taking this vaccine, please, if you're a mother that has a baby, continue breastfeeding the baby. It's okay. Some people say you need to take a week. No, that's not true. That's not right. You have to breastfeed the baby immediately after taking the jab. It's very safe. People that are sickly, people that have other diseases, liver disease, please just come and receive this jab. It is safe for you. So I go to another category of people, that is the people that take alcohol. If you're taking this jab, please first relax the alcohol at least for 3 days. Find a way of relaxing this alcohol because it's another chemical. We don't want to intermix the vaccine and other chemicals or drugs. Alcohol is a drug, we all know that. And it is good that you might take the jab alone and don't intermix. So, according to this Sinovac vaccine, it has a few side effects that it causes to people. Number one, the commonest is headache. When we give you this jab, 1 person out of 10 receives this headache. It's not everyone, so it means the person outside there, you have 90% chances of not getting the headache. And if it comes, we are really available to give you the medicine that counter-interacts the headache. Another thing that happens is the pain at the injection site. I think everyone knows that if you have pain, if they give you an injection, trust me, you get some pain because we are not really rubbing our pepper or we are not, just putting our hands, we are injecting. So there is some pain, some mild pain. But we have trained nurses, trained personnel that really do that work very well. Another side effect that usually happens in 1 person out of 1,000 are the following: muscle pains. Some people get muscle pains, some people get some mild fever, some people get some runny nose. Yes, it happens. The runny nose happens. But if any of the above happens, trust me, you can go to the medical center and you're helped. We have trained our medical personnel to handle those few side effects of the Sinovac vaccine. In cases of some people, okay, very few people really get high severe attacks or what, but that is not an issue because we have immunized people and they're fine and they're okay. Thank you so much for listening.
Thank you very much for talking to Teachers TV Africa. Yes. And this information is going to benefit, besides teachers, but the general population. That's the populace. I have a question. Is it true that when a person is vaccinated, their chances of contracting the virus are minimal, or what?
Okay, wow, that's a beautiful question. When someone is vaccinated, you need to keep practicing the SOPs because we are giving you this vaccination highly to prevent the severe forms of COVID-19. If we give you this vaccination, our beds in hospital will reduce, people on oxygen will reduce, but you can still contract the virus. But if you contract it, it is easily manageable compared to someone who has not been vaccinated. Yes, please.
Thank you very much. And if for us the teachers, do you encourage us to come for this vaccination with our babies, or we should be the ones to be vaccinated, meaning the babies, the students? Are we the only ones to be vaccinated, or even the students for now?
Everyone above 18 years is allowed to be vaccinated. The students will also be dealt with, but we are starting with the teachers that probably move outside, interact with the community, but sometimes our babies are in boarding schools. So we are starting with teachers, but we have another plan for our students and we are thinking about it so hard.
Thank you very, very much for your time, and thank you for being on Teachers TV Africa. May God bless you, Msawo. See you.